You guys make the phones ring, 1-800-270-8642. Joined now by the president and CEO of Children's Miracle Network Hospitals, Mr. John Lauck. John, how are you?
Great. Thanks for having me here.
Absolutely. So glad that you actually happened to be in town, I heard, and at the exact same time, so the timing was perfect.
Yeah, and I heard the Radiothon was going on, so absolutely I could not miss it, so I'm delighted to be here.
So glad that, because we've had some pretty important people that have stopped by, but I think that this might be the biggest one yet. Tell me a little bit about what the CEO of the Children's Miracle Network does in an average day.
Well, in an average day, I visit a lot of hospitals.
I would imagine so, yeah.
We have 170 hospitals in U.S. and Canada, and they are the very best hospitals in every market.
Agreed.
Like here, All Children's, that really service all the kids in the community.
So Children's Miracle Network, and All Children's is obviously a Children's Miracle Network hospital. Tell me exactly what that means.
Well, what that means is that these represent the hospitals that are doing the most good for our sick and injured children in every community. And our mission is really to raise funds and awareness for all of these hospitals and really get the message out there that these hospitals really need public support to be able to do the great work that they do. I think that one of the misconceptions across America is that our hospitals, particularly children's hospitals, have all the resources they need, and that's not the case. With your resources and funds out there in the community applied to this wonderful hospital here in the Tampa-St. Pete area makes a huge difference.
You haven't always been involved in the hospital business side, for lack of a better term. I'm reading your resume here. It's pretty impressive. Tell me about some of the other things that you've done.
I spent the first 30 years of my career on the for-profit side, mostly in food businesses. I was the prior CEO of Mrs. Fields Cookies and TCBY Yogurt.
Love Mrs. Fields Cookies.
I sold pizza for Pizza Hut for about 10 years.
I like Pizza Hut too.
I was in all the bad side of stuff. I probably contributed to putting kids in the hospital.
No. Blockbuster's on there as well.
Yeah.
You've had some pretty cool jobs.
Yeah, I've had an opportunity to really help market some great brands, but nothing has been more fun or fulfilling than being a part of helping spread the message of why our children's hospitals need support.
I was going to ask you that. I'm sure that that working for those companies was fantastic, and you had a wonderful career and everything else. But there's something about I tell people that when we come down here to do these 2 days, it's the greatest and worst 2 days of the year. It's the greatest because of what we get to do, and it's the worst because of the things that you hear. But it all kind of pans out, and you have this sense of just an amazing feeling inside of you once you've met these people and once you've done what you do. I get to do it 2 days a year. You get to do it every day. Tell me a little bit about how you feel at the end of a day after you've made a difference and you know that these kids are going to be taken care of.
Well, I feel pretty humbled and honored to be a part
Humbled
of this.
is a good word.
But I feel I love this job. I love what I do. I love the impact that it has. It reminds me every day that whatever went wrong in my day or whatever was difficult, it doesn't even hold a candle to the challenges that these kids are going through. So it's been a wonderful experience.
I've heard many stories sitting right here where I'm at, sitting across this table from families and from kids also. You've heard hundreds more, I'm sure. Tell me, is there one or a couple of them that stand out a little bit?
Yeah, there's every year we have an annual event in Washington, D.C. where we bring all of we call them champion kids. So these are representatives from all of our hospitals that come, and we actually bring them to meet with the president and first lady, and they meet with their congressmen and senators. It's a great opportunity for them to really tell the story on Capitol Hill. And we give them a chance to kind of see the city. So we organized a series of tour buses, and I had the opportunity to be a bus captain with my wife.
Oh, fun.
And we were sitting in the back of the bus, and I saw a family, one of these families that was on the trip, and they were crying. The mom and dad were crying, and I was worried that something was wrong. I went back and I said, "Are you guys okay?" I noticed that you seem to be upset. And they said, "Oh, no, these are tears of joy." They said,
awesome.
"Do you realize this is the first time in 6 years that we have been together as a family on any kind of vacation. In fact, we've spent most of the last 6 years inside the hospital with our sick son, really by the bedside, caring for him. And this is the first opportunity he's had to leave the hospital and to do a trip like this. And it just
Awesome.
reminded me, not only are these challenging circumstances for these kiddos, but they're tough for the siblings and the parents.
I've talked to a lot of siblings over the years, and they're just as strong. I mean, they have to be there for, their sibling and their parents.
Yeah,
I
absolutely.
mean, the parents got a lot going on, and obviously the kid has a lot going on, but the little brother or big sister has a ton going on as well.
Oh, yeah, absolutely. And the other thing that they were just overwhelmed with is the fact that they said, we didn't have the financial resources to be able to take care of our child. And
Right.
they were so grateful for what had been done through Children's Miracle Network Hospitals fundraising to make possible the miracle that had happened with their child.
And one of the things that we always say, and one of all children's biggest things, is no child is turned away regardless of the ability to pay.
Yeah, that's
I mean,
absolutely correct.
The child comes first. We'll worry about everything else later on. I was also reading here, John, talk a little bit about the aggressive plan that you have to meet by 2022.
One of the things I did when I started 4 years ago is I had a passion to ask every single hospital I went to, how much do you need? What's the gap between what is supplied today in terms of expenses to be able to treat these children versus what you really need to do the job? And the answer that I got across the country was we need about 4 times more. That was staggering to me. I thought
that's a lot.
even double would be a lot, but 4 times more. And I said, I was asking the question over the next decade. So we set an agenda for the year 2022 to try to quadruple the amount of fundraising in every single hospital so that we can meet the needs of what our doctors, our nurses, our caregivers need to be able to provide this care for our kids in the community.
That's amazing, and I'm glad to be a part of that $1 billion that you want to raise.
$1 billion is the amount.
That's a staggering number, and I hope that we can help out. One of the things I think that people forget is not only the doctors get paid. There's so many things that need to be put into a hospital. I mean, these beds aren't cheap, and all the other things that go into it, the research and everything else. But you forget about TICO. They want their part too. The lights don't come on by themselves. I mean, there's a power bill to pay. There's phone bills, and there's all these other things that go along with everything else. And I can see how they could need 4 times as much money. Everything is more expensive now.
Yeah, and there's 2 things I think a lot of people don't understand. One, I think everybody says, well, gee, doesn't insurance pay for that, or doesn't Medicaid?
Mm-mm.
No, those don't even come close to really paying for all of the care and the need. The other thing that's really different from adult health care, these kids come in all sizes and shapes.
They do.
From as big as the palm of your hand all the way up to, the big teenagers. And for every size child, there's a different set of procedures, there's different size equipment that's required. And so the expense for children's health care is a lot greater than it is for adults.
Yeah, because you can't prefab.
Right.
What would fit you would also fit me. But what would fit Isaiah over there won't fit a 16-year-old boy.
And the other amazing thing too is with innovation in pediatric health care, there are more and more cures, there are more and more procedures available to be able to save our kids. You take pediatric cancer, just 10, 15 years ago, a good deal of children that have pediatric cancer don't make it. Today, the cure rates are above 90%.
It's awesome.
All because of the innovation that's gone on, and to a great part for the contributions that people make to be able to support the research, the treatments, and the care.
So if you could say one thing to the people that are listening right now, John, what would you say?
I say open up your hearts and give. This is a time of year that I think we kind of count our blessings and we think towards maybe the next year and the future. And I would just remind everybody, these kids are our future. 1 out of 10 children in America every year are treated by a wonderful hospital like All Children's here in the Tampa-St. Pete area. And I would just say give generously.
The saying is put your money where your miracles are.
Absolutely.
All right. John, thank you so much for stopping by and taking the time to talk to us. So much information is inside your head right now, and I'm just glad we got to tap a little bit of it, so thank you so much.
You're welcome.
1-800-270-8642 is the phone number, and if you can't